Good morning. Thank you for joining us today. First, Dr. Don Yealy, UPMC's Senior Medical Director and the Chair of Emergency Medicine at UPMC, will update us on the COVID-19 in our communities that UPMC serves and how that continues to inform our actions. Then Tammy Minier, UPMC's Chief Quality Officer, will discuss UPMC's preparations for the fall, when both flu and COVID-19 are likely to be a part of the picture. After our experts give their remarks, we will take your questions. Dr. Yealy.
Thank you very much, and thank you all for joining this opportunity to educate and learn more about UPMC's experiences and efforts with COVID-19. UPMC's total cases of COVID-19, that is, people who have the virus and required hospital care, have been on a downward trend for weeks, even with the opening up of our economy and gatherings for social justice around the regions that we serve. System-wide, we're at the lowest numbers of hospitalized COVID-19 patients since early April. And currently we have about half the number of people hospitalized that we had at the peak of the pandemic here in our communities. So as we and as others increase testing, looking for all types of people who might have the virus, we do expect to see increases in numbers of people who have the virus contracted. We expect that to happen often in younger, healthier people, and we're seeing that trend across the southern United States. What's most important now is we need to change our mindset and focus on not just or exclusively on number of cases, but the severity of illness. We shouldn't just be counting those who have a diagnosed infection. For the vast majority of people testing positive, their illness is mild or they don't even know that they have any symptoms of COVID-19 infection. The younger, healthier people who are becoming infected may be helping build our collective immunity, something that helps in any viral pandemic. This pattern is reflected in what we see nationally. The number of positive diagnoses is rising, but the mortality, that is the number of people dying, is dropping. That's why we watch hospitalization rates and we watch the need for intensive care, and those numbers too are coming down compared to the peak. This indicates that people in our communities who are the most vulnerable to the disease are better protected now, and those getting it now tend to be the ones who recover well or have little signs of infection. Though we can't know for sure, we attribute this good news in our regions to a variety of factors, and those factors include our communities did a great job with common sense infection prevention techniques. Frequently washing your hands, staying home when you're sick, physical distancing, and wearing masks as much as possible and wearing them correctly. Remember, if I can see your nose or I can see your mouth, you're not wearing your mask correctly. This virus, like many other coronaviruses, may change with the seasons. The increasing humidity in western and central Pennsylvania, coupled with fewer people that are in crowded indoor settings, may slow the spread. Our health systems and our public health partners began monitoring and screening for the virus very early on. UPMC had screenings in place nearly 6 months ago and well ahead of the first recognized case. We continue to test many people, more than anyone else in our communities. These measures not only allow us to identify people who feel sick, but to identify those who don't even know that they're sick so that we can quickly act. We can not only identify them, we can isolate them, we can give them the education necessary, and trace all of the people who need the same basic actions. This helps us contain the spread. We've recognized that very early on, the elderly and skilled nursing facilities are particularly vulnerable to this disease and to poor outcomes. And we've guided measures locally, regionally, and nationally to help protect this population. We are also seeing improving outcomes in patients with COVID-19 as we've gained experience in how to best care for them. When the first cases of COVID-19 illness in the United States were identified, The inclination initially was to place all severely ill patients on breathing machines, called a ventilator, right away. At UPMC, we learned to use other options first because we found out that once a COVID-19 ill patient was placed on a ventilator, it was difficult for them to ever successfully come off that ventilator, and their outcomes simply just aren't as good. Right now, today, we have 14 COVID-19 patients across our entire system that are on those breathing machines, a ventilator. That's among the lowest numbers that we've had since the beginning of the COVID-19 experience across all of UPMC. And it's a fourfold decrease from the peak that we saw in April. We've also done pre-procedural testing on people who have no findings suggesting COVID-19 illness or infection. And we've done that in over 15,000 patients in all the communities that we serve. The positivity rate that's the people who don't know that they have the virus, is around 1 in 400, a number that's been stable for weeks. So there's not a large number of people who are harboring virus that we don't know about. When we find a positive case, we're also seeing that the viral load is much lower. That is, we find less of the virus in all the samples, whether the person has no symptoms or feels ill. In summary, what our experience shows is that fewer patients are being admitted, and when they are, they tend to be much less sick than at the beginning or the peak phases of the pandemic. We also have many more tools in our arsenal to help treat patients. This includes remdesivir. That's the antiviral drug you've heard about that shows some promise to improve outcomes in patients with the COVID-19 illness. To make sure that we use this precious resource the best possible way, UPMC devised a fair distribution protocol that was adopted by others, not only regionally, but across the state and the country. As we speak, the Journal of the American Medical Association is publishing a UPMC authored article on how to use this allocation policy wisely. UPMC also has a robust study arm to investigate steroids, something that you've heard about last week from the United Kingdom. Our REMAP COVID approach, which allows us to treat and learn at the same time, has embraced this as one of its opportunities. Steroids are powerful drugs that dampen an overactive immune system. The news last week from the United Kingdom was very exciting. It showed that dexamethasone, a very specific steroid, could help improve survival. We'll be studying it and are studying that right now too. And our convalescent plasma program, where we screen survivors and those who have recovered from COVID-19 infection and illness and accept their blood plasma donations to use for others who are struggling with the illness, continues to grow. The timing of a safe and an effective vaccine is still a big if. We need to remember that vaccines work best in younger, healthier people, and they may not be as effective as we hope for in the elderly who have a weakened immune system. We have work towards developing therapeutic antibodies, that is, where we create and augment that immune system as a prophylactic treatment, something that helps you prevent getting the infection. And we'll talk about that more in detail in the upcoming weeks. Overall, the people most vulnerable to severe COVID-19 infection and illness continue to be the elderly and the immunocompromised, with most of our hospitalizations still coming from skilled nursing facilities that are outside the UPMC system. We've continued our testing of residents and staff at UPMC senior communities, including people with no symptoms of COVID-19 illness or infection. And this is to keep those populations and those workers safe. That, plus our staff being trained and using the best practices and equipment, is working. Of the more than 1,250 people that we've tested in those settings so far, we've found one positive case in a new resident who had no symptoms at all. We believe the resident likely contracted the virus outside of the facility, and we were able to detect it with our testing plan. We quarantined the resident, and that person never developed symptoms and is now without signs of the virus. Our protocols stopped a potential outbreak. Most alarmingly to me is a recent CDC report that showed a rapid decline and a sharp one in emergency department visits, including those for serious and life-threatening conditions like heart attack, like stroke. This happened within weeks of the declaration of COVID-19 as a national emergency. It's implausible to think that so many few people are now not having those medical emergencies. It indicates that people are avoiding the hospital because of their fears over coming in contact with COVID-19. As an emergency physician, this represents to me unnecessary deaths that are attributable to the pandemic, but not directly from the cause of an infection. I want to stress, if you are having a medical emergency, come to the hospital. Our hospitals are safe and we're ready to care for you. Don't make a bad decision because of your fears. Tammy Minier can now discuss our preparations to continue caring for you now and well into the future, into the fall, and with the arrival of the flu season.
Well, thank you, Dr. Ely, for that wonderful report. It is indeed heartening that our COVID-19 cases continue to be so low in our communities. This is good news, for sure. However, it does not mean that we're letting our guard down at UPMC. While we do not know what the fall and winter will bring, we are diligently preparing for whatever might come. That means growing our supply of personal protective equipment, including masks, gloves, face shields. We intend to have a continuous supply for 3 months of all of those items available. Our 3D printing program that we've spoken about before has allowed us to increase our number of nasal swabs used in testing. It's expanding to other needed supplies, including replacement parts for our ventilators. We are evaluating the accelerated distribution of the flu vaccine to our employees to early fall, before we typically see an uptick in respiratory viruses. UPMC's universal flu vaccination program has been recognized for years for having a near perfect vaccination rate among our healthcare workers, and it is an important part of us keeping our staff safe. Within UPMC Enterprises, we're continuing to expand and strengthen our tele-ICU app for the use across our system and for partnering with other hospitals, as you saw us do with New York Presbyterian. We are also looking at smart ways to continue to expand our specimen collection capabilities, including the creation of a mobile unit for people who can't travel, as we've done for our senior communities over the last several months. And we're putting in place protocols to allow us to participate in the COVID vaccine trials, whether our own PIT-developed vaccines or for others outside of our walls. But I want to caution again, the vaccine is still a big if, as Dr. Ely has mentioned. We will be part of the national network that contributes to the evaluation of the effectiveness of those vaccines made available. Our key focus right now remains and needs to be on taking care of our vulnerable, elderly, chronically ill, and immunosuppressed populations. Because we've said, even with a vaccine, these populations often don't mount as robust a response to immunization, we must continue to explore other ways to keep them safe, such as therapeutic antibodies, as mentioned by Dr. Ely. We worked hard to get our care levels back to 100%, and we intend to do everything in our power to continue to provide care to our communities and what they will need and expect to need through the fall and winters. The reality is, come October and November, we are going to see cold and flu-like symptoms in our communities. And for the most part, these won't be COVID-19 infections. But one thing is for certain, infectious diseases will be a part of our future. Fortunately, UPMC is one of a handful of sites nationwide that monitor for respiratory infections within our communities through the CDC-funded surveillance study. We will have a pulse on what is happening and be able to pivot to meet those needs. I'd like to thank all of our staff for their ongoing cooperation and diligence with the added screening and masking protocols to ensure the safety of our facilities. Our healthcare workers have stepped up to the challenge, and we have been here to help and will continue to be here to help our society emerge safely and scientifically. Meantime, we need you to continue to do your part with physical distancing, wearing masks, and hand washing. We all have a responsibility to protect our most vulnerable, ill, and compromised loved ones, even as we all eagerly return to work and to a more normal life. It is the absolute right thing to do.
Okay. Thank you, Tammy. Thank you, Don. And now we'll take questions from the media, all of whom are joining us remotely online. To members of the media, to ask your question, go to the bottom of your page and press the raise your hand button, and that will put you in the queue. I will read your name and your line will be unmuted for you to ask your question. Please make sure to unmute your microphone on your end. We'll try to call on as many different media outlets as we can in the time that we have allotted. Again, go to the participants icon at the bottom of the page and press the raise your hand button. That will put you into the queue, and we'll go from there. We do have some email questions that have come in to us, and prior to this, the first is from the Erie News Now. Is there any different focus for the Erie region for the fall or a potential second wave? Any need to have more beds ready if COVID, flu, et cetera, all hit at the same time this fall or this winter?
That's an excellent question, and it gets to the heart of, does every region have the same experience with any particular infection, including COVID-19 illness and infection? And the answer is there's often some differences in the amount of virus, the population who acquires the infection, and how they respond to it. The general answer is that our job across all the communities that we serve is to be ready for the worst, but to respond to what the realities are. And that means we have to have aggressive, well thought through testing and surveillance programs. We know about hotspots before they become overwhelming. And whether you're in Erie or in central Pennsylvania or here in western Pennsylvania, the tenets of our approach will be the same. We managed through much higher numbers of COVID-19 infected and ill patients back in April, using all of our assets. We never used more than 5% of our ICU beds and ventilators, and we now have that experience. And we will deploy that again, whether it's in Erie, western Pennsylvania, central Pennsylvania, do the smart things at each individual site and use the strength of our network. We will look carefully for any signs of what the reality is, preparing for what we predict, but acting upon what we see.
Dawn, I would add, too, that one of the strengths of the organization is our ability to manage and look at our patient activity across the vast enterprise hour to hour. We are able to adapt and modify and target supported activities to any region at any given time based on our ongoing monitoring of that activity.
Great. Thank you, Tammy. First question we'll take from the media is from Paul Goff, Pittsburgh Business Times. Paul, please go ahead.
Hi, Paul. Thank you. Can you hear me okay?
We can hear you, Paul. Go ahead.
Great. Thank you. So we've been seeing, I appreciate what you said this earlier about what you've been seeing surveillance-wise and also through the hospital systems. We've been seeing in Allegheny County these numbers shoot up over the last several days. There were 45 on Monday and then again 45 today, breaking news. Do you have a sense of, are you seeing that? Is this younger people with, with less of the virus? Because as you mentioned, the hospitalizations haven't increased too much, but on the other hand, they could lag, if I understand correctly. What are you seeing sort of on the ground here in the Pittsburgh region that would either bear or not bear out those numbers?
So those are interesting observations, and thanks very much, Paul. A few things. Again, I think counting the number of people who have the virus detected on them, quote, a case, is interesting, but it's not the most dominant way to assess how we're doing within this particular pandemic. So having more cases by itself is not necessarily a harbinger of bad things. We have recognized that there is some fluctuations in the total number of cases. When you take a step back, it has not dramatically gone up. Secondly, as you've noted, not only the absolute number of people with serious sickness, but the relative percentages is dropping. So it does suggest that while there may be different numbers of people acquiring the infection, it's not having the same impact that it did even 6 weeks or 2 months ago. We expect to see fluctuations like this. I don't know for how long that will be. Our job is to measure, react, and prepare. And I don't see any signals yet that would suggest that what's happening is an impending high load of people with very serious illness in our communities that we serve. I'm seeing fluctuations as people get back to normal, often in more healthy people who tolerate an infection very well. That actually is a good thing. That means collectively we will have acquired some more immunity without the harms that go along with the infection.
And my only point to add to that would be to reinforce our messages again. We need to stay vigilant. We need to be able to continue wearing our masks appropriately, washing your hands, using social distancing. Despite all of the points that Dr. Yealy made, that is our go-forward plan for keeping us all safe.
Yeah, and one other addition, many young people may acquire the infection now and may do well with it. Our job is to make sure that they still honor the personal safety such that others who are vulnerable and might do worse. So we're not saying go out and do whatever you want. Be smart about it. Use the hand washing, wear the mask, distance if you're going to visit elderly relatives, immunocompromised friends. Those are still important. That's the smart public health that we still need to be vigilant about.
Thank you. Next question comes from Holly Patterson with the Greenville Record Argus. Holly, please go ahead.
Good morning. As we're looking into coming into the flu season this coming fall, what is going to be happening for people who are presenting with flu-like symptoms that mirror those that are like the corona symptoms?
That's an excellent question, in that what will be happening is what has been happening, in that when patients present to any of our UPMC physicians or care delivery sites, we conduct the appropriate evaluation, and if they are symptomatic and have symptoms that the practitioner believes represent potential COVID, we will test them as we are now. It will be our ongoing monitoring and evaluation of that allow us to be assured that we're taking care of the right disease and differentiating as much as possible.
Next question, Bill Kibler, the Altoona Mirror. Bill, please go ahead.
Can you hear me?
We sure can, Bill. Go ahead.
Okay. The first question sort of stepped on this a little bit, but I'll ask it anyway. Do you think there's been a misplaced emphasis in the national media recently on the rising number of cases and not enough on falling death rates?
Well, I'm not certain I could use the word misplaced, but I think that sometimes the nuance of understanding the path through an infectious threat like this requires thinking that's beyond just counting the total number of cases that are detected. Infections have come and gone since the beginning of time, and they go for a great many different reasons, in part because of recovery from very many people who have acquired the infection. We think it's really important right now to add to the conversation and actually shift away from purely just counting total number of positive cases. We think it requires much more careful thinking and identifying who's going to do poorly and what does poorly mean. And poorly means you have to stay in the hospital, you need added care, or there's a threat to your life. And that's where we need to focus our activities, not on people who have an event that is largely without symptoms and with complete recovery. So I think it's an opportunity to shift or to pivot the conversation.
Okay, thank you. Next question, Bob Mayo, WTAE TV. Bob, please go ahead.
Yes, can you hear me?
We can hear you, Bob.
Okay. It seems as though there's a balancing going on here between, on the one hand, you're talking about the higher numbers perhaps shouldn't be taken in the same way as they were in the past because there may be people with milder outcomes, and acknowledging the importance of protection. For people who are vulnerable, is there any basis for saying, well, they may be vulnerable, but it probably won't be as bad for them? Because it seems as though when people hear the one part of the message, there may be an inclination for them to take the other part of it less seriously.
I think that's an excellent point. If you're vulnerable, and that means you're elderly, you have underlying serious medical conditions, you're immunocompromised, you still need to have the highest level of vigilance. And those who come around you still need to practice all those things. And we're trying to reinforce exactly that message. This is not a one-size-fits-all. It's also part of the reason why many people struggled with broader interventions to help. It never was going to eliminate the pandemic, but to spread the pandemic out in a fashion that made it easier to deal with. Those are hard to sustain, and when they're done exactly the same for every type of person, people begin to find difficulties. We think we need to be smarter about this. Young and healthy do the smart basic things. If you're at higher risk, improve your health and be extra vigilant about those contacts. Begin to carry on more of the activities or less of the actual contact as before. It is not one size fits all.
Next question comes from David Winter of Penn Live. David, please go ahead. David, please make sure to unmute your microphone, please.
Okay, I just did.
Okay,
Thanks.
go ahead.
Dr. Yealy, I think there's a lot of differing opinions among doctors about the level of immunity and how long the immunity might last, and really, how valuable the immunity is. So, you seem to think that you've mentioned immunity several times, and could you please sum up the level of immunity that you do think exists, and how much confidence you have in it?
So first and foremost, these are excellent questions. This is a virus that in October of 2019, I didn't know existed, and neither did anyone else around the globe. And so our experience is really the past 6 months of people with the infection and with recovery. So to have any declarative and very clear statements about what does immunity look like for everyone and specific groups and how long it will last is virtually impossible to have. We know that younger people acquire immunity sooner and keep it longer. We know that older people, even with an infection or with a vaccine, as you heard, don't often develop the same immune response, same as with people who are immunocompromised. So it's a very complicated question. Secondly, we know that while we can test for antibodies, it's not a perfect relation to are you immune now and how long will you be immune. We are working on all of those problems. So I guess I would say to you is that we know that immunity is developed. It's hard to identify what's the quantifiable amount in any individual or subgroup, but it's a part of the equation. And we know from previous infections with either different coronaviruses or other pathogens that immunity in the population plays an important part. Beyond that, I wouldn't be able to give you any more specifics. I just know it'll be part of the answer. It won't be the only answer. It'll be part.
Okay, thank you. So again, to ask a question, go to the participants icon at the bottom of the page and press the raise your hand button, and that will put you in the queue. I'll read your name and your line will be unmuted. Please make sure to unmute your microphone at your end to ask the question. I'd like to go to an email question now. What is your data showing about the hospitalization rate for Black people in the communities you serve versus white people?
So focusing on Allegheny County, where I have the most granular data, Black people in the county make up about 13% of the population. And in our testing programs, we test about 17% of our population tested are Black. So I think that UPMC has embraced the opportunity and the need to test in our Black population very, very well. About 22% of the patients admitted across UPMC are Black, so it's a little higher than the background population. But those dying and those requiring intensive care are not at higher rates. So overall, I think the experiences, particularly in Western Pennsylvania, are actually much better than concerns that you may have heard from across the country, where in fact, with every individual measure, there was much more vulnerability and poorer outcomes amongst that particular population. We're committed to not only identifying ways to improve the current health, but how to sustain that moving forward, how to make sure that there is adequate surveillance. We've talked about our efforts not only currently to test, but what we could do differently and better to test in those communities and in every other vulnerable population.
Next question comes from Carrie Pauling, northcentralpa.com. Carrie, please go ahead.
Hi, thank you. My question is around masking. I feel like there is I feel like there's a dissension somewhat among residents of Pennsylvania about wearing masks, especially with the HR 836 and the attempts to end the disaster declaration. People seem to believe that the order from the Secretary of Health is no longer in place, or it's not to be adhered to. And I just wondered if you could clarify, do you in fact support the Secretary of Health's order for masking? And do you think everybody should be masked in public?
Absolutely. We continue as an organization to support and endorse that position. We recognize, as Dr. Yealy and I have both mentioned, that this is an important way to protect our vulnerable populations, to take care and assure that we're doing everything we can to keep our community safe.
Okay. Thank you, Tammy. We have a follow-up question from Holly Patterson of the Greenville Record-Argus. Holly, please go ahead. Holly, please unmute your microphone.
Can you hear me now?
Yes, we can, Holly.
Okay, I apologize. I hit unmute and then it popped back up to mute. My follow-up question is approximately how many tests have been given through the UPMC system? How many are presenting without symptoms? What is that percentage? And then how many are presenting with symptoms and the actual disease?
I don't have this morning's numbers, but we've done well over 25,000 total tests, and 15,000 plus have been in people who have no symptoms of the disease. Part of our recent program for people who are coming back, engaging in procedures for care. And we've been continuing that activity. In the people who have no findings of illness, the frequency of a positive test is about 1 in 400, about 0.27%. So it's very, very infrequent. In people with symptom, the overall average is about 3%, but it's been dropping over time. So it has changed our experience, and including even with better and more testing, our experience and our numbers have changed dramatically. Most times when we suspect COVID-19, it ends up not being the cause of your illness. That doesn't mean that it's still not an important consideration. We will always search for it and try to provide the best care.
Thank you. Next question, Joe DiStio, KDKA Radio. Joe, please go ahead. Joe, unmute your button, please.
Yeah, is it on mute now? It popped back on.
Yeah, you're good to go, Joe.
Good, thanks. I'm wondering about testing in the fall, when a lot more of us are going to have at least cold symptoms. I know I've had the simple cold many times in the fall. Never once have I thought about getting tested for anything. Do you foresee a much greater demand for testing, people flooding to hospitals and their doctors' offices? Will the testing be available that way? Will there be any change in testing from people worried about COVID when they may have, a mild case of the flu or simply the common cold?
I do expect that there'll be increased demand not only for COVID testing, but for other viral pathogens. We fully expect that. That happens every year. I suspect, given the experience that everyone's had, both providers and patients, and all of the background coverage, that people will ask more for that. We have been committed over the past few months to increasing our capabilities and our efficiencies in testing. We will continue to do so to make sure that we can serve that need. I don't know that it'll be a deluge. We will manage and we will be able to provide guidance. Not everyone will need a test, much like not everyone needed it now. We want to make sure that we deploy the resource as smartly as possible, not only for people who are sick, but to learn about what's happening in our community. So yes, there will be more activity. We will learn more from it, but I'm confident that we'll be able to meet those demands.
I would agree with you completely, Don, and we do fully expect, the anxiety that has been in our community about the fear of COVID, I think will continue to be at a constant level and will affect what we're doing in the fall. So we are ready, we are prepared, we fully expect to see some of those increases and are here for you for whatever you need.
Okay, thank you. And that concludes the time we've allotted for today's press briefing. Thank you, Don. Thank you, Tammy. In about 45 minutes, we'll email media attendees a link to download high-definition footage of this entire press conference, which we encourage you to use in your news reports. Reporters with follow-up questions are encouraged to contact our UPMC Media Relations Department at upmc.com/media. And please follow us at UPMC News on Twitter, for updates. Thank you.